Work-related contact dermatitis in you. An overview for employers, supervisors, and workers. Learning objectives. After participating in this e-learning session, you will have learned that work-related contact dermatitis, or WRCD, is common. WRCD is preventable. Many workers in Ontario are at risk for WRCD but don't know it. Recovery from WRCD can be difficult for a variety of reasons. And early medical intervention is critical. The earlier a person with WRCD is diagnosed and treated, the more likely they are to get better. Contact dermatitis. What is it? Contact dermatitis is a skin reaction that looks like a rash or burn. It can be itchy or painful and can be caused by exposure to an irritant contact dermatitis, or an allergen, allergic contact dermatitis. Symptoms may appear almost immediately after exposure to strong irritants. Living with contact dermatitis. Kevin is an IT worker at a Toronto area hospital. Click on the buttons below to hear Kevin talk about what it's like to live with a severe case of contact dermatitis. What sort of skin symptoms did you first notice?
It started off as a small rash on my hands, and over time the pain and itchiness were extreme, affecting my sleep, and I started to become worried about having permanent damage to my hands, which may then have turned into fundamental lifestyle changes, maybe loss of employment. At its worst, the skin on my hands became so compromised that I lost my fingerprints for several months. As a result, I would sometimes drop things, or I would have difficulty feeling things with my fingertips. My symptoms became so bad that my fingers were so swollen, I couldn't wear my rings. I couldn't completely bend my fingers. And I guess this all culminated with me going to emergency, being diagnosed with a skin infection on both hands, receiving IV antibiotics and home health care for 10 days.
How did those symptoms affect your day-to-day life?
Well, I try not to be self-conscious about things like this, but I did find my condition to be very embarrassing. My hands looked terrible. The blisters would ooze, and sometimes my hands would crack and bleed. My condition absolutely interfered with performing basic tasks around the house, and even now, well after recovery, I have to be very careful about exposure to very common household chemicals, including dish detergent. I can't even wear so-called hypoallergenic gloves. My treatment was bothersome, as there were times when I was applying various creams and lotions literally dozens of times per day, and really not getting much resolution from that.
How long did it take you to get a diagnosis?
Diagnosis time was a big issue in my case. It took many doctor visits to resolve this. I started asking my current family doctor about my symptoms in early 2003, and it was not resolved until I reached a significant crisis in autumn of 2013.
Living with contact dermatitis. Click on the buttons below to hear Kevin talk about what it's like to live with a severe case of contact dermatitis. Describe your experiences with your family doctor.
I feel that family doctors really don't know how to treat this kind of thing. No one really asked me about possible workplace exposures until my dermatologist raised the issue in November 2013. My family doctor didn't seem to understand the severity of the problem and kept diagnosing it as just an eczema, and gave me a few different steroid creams over the years, none of which really offered much relief.
What other medical resources did you come across as you sought treatment?
Well, no one really seemed to have any sense of urgency about my situation. For example, my initial dermatologist appointment was to be several months into the future, but at that time I was in a severe crisis. My family doctor eventually fast-tracked this when he saw how severe my situation had become. I did a lot of my own internet research as an attempt to diagnose myself and as an attempt to try and find resolutions. I reported my problem to my workplace occupational health department, and bear in mind that I work in a hospital, but they seem powerless to be able to assist me beyond suggesting hand soaps and hand creams, to which I later proved to be sensitive. I also sought out the help of a naturopath who was quite helpful in providing alternate remedies.
How long was your recovery time following diagnosis?
I experienced a very long recovery time. I was off work for 3 months, and it took several more months after that before I could completely function without taking significant precautions, since the skin on both of my hands had become so severely compromised.
Work-related contact dermatitis, or WRCD. What is work-related contact dermatitis, or WRCD? Work-related contact dermatitis, or WRCD, is dermatitis that's caused by exposure to an irritant or allergen at work. WRCD is common, especially among people involved in wet work. Click below to see examples of workers who are particularly vulnerable to WRCD. Dishwashers, auto mechanics, and people who work in healthcare are especially vulnerable to irritant dermatitis. People who work with allergens such as resins, rubber chemicals, metals, and biocides are vulnerable to allergic dermatitis. Meet Lee and Sheldon. Lee and Sheldon are workers in Ontario. Throughout this module, you will learn more about Lee and Sheldon, their work environments, their health and safety concerns, and their attempts to achieve wellness. Based on content in this module, you will be asked to make suggestions and/or recommendations to assist them with their health and safety concerns. WRCD is common. In some industries, up to 20 to 25% of workers may have dermatitis involving their hands. The majority of these cases are irritant in nature. For example, 21% of male indoor cleaners reported a rash in the past year. 26% of hospital personnel reported current skin problems in a study carried out in Ontario. Click Next to find out which occupations are most affected. Most common occupations affected by WRCD. The most common occupations affected by WRCD are agricultural workers, automobile and aircraft assembly workers, beauticians and hairdressers, chemical workers, cleaners, construction workers, cooks and caterers, electronics workers, healthcare workers, machine operators, mechanics, and metal workers. The most common irritant? Wet work. Wet work is the most common exposure causing irritant contact dermatitis. Unlike Canada, Germany has a regulation to protect workers exposed to wet work. In the regulation, they define wet work as skin exposed to liquids more than 2 hours per day, use of occlusive gloves more than 2 hours per day, clean their hands very often, that is more than 20 times per day or less if cleaning procedure is more aggressive. 10 common occupational allergens and their common uses. Epoxy resin is used in the making of adhesives, glues, and sealers. It's used to make aircraft assemblies and in autoplastics, primers, construction, fiberglass manufacture, and flooring material. Thioram is used to make rubber products. Carbamates is used to make rubber products, pesticides, detergents, and fungicides. Nickel sulfate is used to make paint and wallpaper pigment, paint for glass, enamel, dyes, electrical wiring, fuel additive, ceramics, and pesticides. Cobalt chloride is used to make bricks and cement, metal carbide, cobalt-based pigments and additives to paints, pottery, and print inks. 10 common occupational allergens and their common uses. Continued. Potassium dichromate is used on leather, cement, auto industry primer paints, and rust-proofing products. Glycerol monothioglycolate is used in hairdressing products. P-phenylenediamine is used in hair, fur, textile and leather dyeing, printing ink, black rubber accelerator, oils, and greases. Formaldehyde is used in embalming, pathology, preservatives, metalworking fluids, anti-mildew agent, found in some paints, inks, resins, and plywood. Glutaraldehyde is used as a disinfectant for medical or dental equipment and embalming. Case Study Learning Activity. Click on the numbered buttons below to learn more about WRCD risk factors. Lee works as a dental assistant and has been working in the same role for 10 years. She considers herself healthy and fit and works out almost daily. Lately, she's experienced an itchy rash, is having trouble with some fine hand movements, and has mild asthma, though she is in good general health. Dental workers, along with other healthcare workers, hairdressers and beauticians, chemical workers, cleaners, agricultural workers, food service workers, electronics workers, machine operators, mechanics, metal workers, and vehicle and aircraft assemblers and construction workers are at higher risk of WRCD. A rash is a symptom of WRCD. It can appear almost immediately if exposed to a strong irritant or after weeks, months, or years of exposure to irritants or allergens. A 2010 study found that WRCD is associated with impaired hand grip in 80% of CD patients and numbness in 50% of CD patients. Both WRCD and occupational asthma, or OA, are associated with exposure to epoxy resin, nickel sulfate, cobalt chloride, potassium dichromate, paraphenylenediamine, formaldehyde, glutaraldehyde, and acrylates. Case Study Learning Activity. Click on the numbered buttons below to learn more about WRCD risk factors. Sheldon is a cleaner at a small long-term care facility. He has no major health concerns aside from a persistent rash on his arms. Although he finds the rash embarrassing and occasionally itchy, his doctor is not particularly concerned. The doctor suggested that he apply aloe vera lotion when the itch is especially bad. Cleaners are at increased risk of WRCD. One CREOD study found that 21% of male indoor cleaners reported a rash in the past year, and that 31% of hospital personnel reported hand dermatitis. One study found that 33% of CD patients find the condition embarrassing and that CD interferes with leisure and social activities as well as work. A CREOD survey of workers with WRCD found that doctors provide minimal advice about how to modify work to protect skin and hands. CREOD surveys have found that less than 45% of doctors ask patients about workplace exposures. Both family physicians and dermatologists reported that the main barriers to detailed history taking were lack of time and experience. WRCD is preventable. Several recent reviews of occupational skin disease examined prevention strategies and recommended the following methods for prevention. 1. Substitution with a less hazardous material. A CREOD study of dental staff and students found that changing to low-protein, powder-free latex gloves led to a decrease in latex sensitivity. Students who entered the school after the introduction of powder-free gloves showed no sensitivity at all. 2. The use of appropriate protective equipment, usually gloves. Wearing cotton liners under gloves may help prevent irritant contact dermatitis. 3. The regular use of moisturizers, particularly those that are lipid-rich, helps prevent WRCD. Some pre-work barrier creams may be helpful, but are generally not effective for prevention. Case study learning activity. How can workers like Lee and Sheldon prevent WRCD? Drag only the items that can be used to prevent work-related contact dermatitis into the bag below. Correct answers will heal the hand. Hand washing, powdered gloves, barrier cream, changes to diet, cotton glove liners. Knowledge check 1. Check your knowledge by answering the following question. Contact dermatitis can be prevented by hand washing. Incorrect. The correct answer is the use of a lipid-rich moisturizer. Hand washing, frequent application of antibiotic creams, and changes in diet have not been shown to prevent contact dermatitis. Correct. The use of a lipid-rich moisturizer can prevent contact dermatitis. Knowledge check 2. Check your knowledge by answering the following question. Cotton glove liners can help prevent contact dermatitis. True or false? Correct. Cotton glove liners can help prevent contact dermatitis. One of the ways to educate workers about risks is through training programs. A recent CREOD survey of workers with hand dermatitis being patch tested and assessed for WRCD found that most had been through some occupational health and safety training or WMIS training in their workplace, but training for glove use, skin care, and hand washing was much less common, especially among workers involved in wet work. Click on the numbers below for the full story. 33% of hospital personnel reported receiving skin protection training. A survey of indoor cleaners found that cleaners with a skin rash were less likely than other cleaners to have received workplace training regarding their skin. Among those who had received training, the workers with rashes were more likely to report that they had found the training hard to understand. "50% of survey respondents reported that incident reports were routinely filled out and that modified work was available for people with skin problems. 75% of survey respondents reported that their workplace does not regularly conduct assessments for skin hazards, provide access to an on-site occupational nurse or physician, or pre-placement medical skin examinations. "75% of survey respondents reported that WRCD preventing moisturizer or barrier creams were unavailable in their workplace. Almost 100% of survey respondents reported that their workplace did not have a skin protection program. Skin allergen resources. Skin allergens may be identified as skin sensitizers in commonly used occupational health and safety resource material. A CREOD study that identified the 10 most common skin allergens looked at how information about these allergens is communicated in common occupational health and safety resources. The researchers examined 3 resources in 2010, the ACGIH TLV book, the NIOSH Pocket Guide, and the NLM HAZMAP. The only resource that noted that all 10 of the allergens were sensitizers was the NLM HAZMAP book. Knowledge Check 3. Check your knowledge by answering the following question. Most workers do not realize they are at risk of WRCD. Why? Few Ontario workplaces have practices or programs in place to prevent or address WRCD. There is a significant lack of awareness regarding WRCD in Ontario's service sector. Skin allergens may not be identified as skin sensitizers in commonly used occupational health and safety resource material. All of the above. Incorrect. All of these factors contribute to WRCD risk. Correct. All of these factors contribute to WRCD risk. Recovery from WRCD is difficult. Sheldon's rash has been described as persistent. Unfortunately, his scenario is not uncommon, as cases of WRCD often go unresolved for years. Click the buttons on the left to discover why. Timeliness of intervention. Early diagnosis and management improves outcomes. In one CREOD study, intervention within 1 year of rash symptoms resulted in improvement in 53% of cases. Intervention more than 1 year after the rash appeared resulted in improvements in only 23% of cases. Diagnosis time. Getting a diagnosis for WRCD can take a long time and many doctor's visits. In a survey of workers with hand dermatitis, they found that the average time before a worker was seen in the specialty clinic was 25 months. On average, workers had seen their family doctor 5 times before they were referred to the clinic. About 70% had seen a dermatologist an average of 8 times. Another study found that 20% of people with WRCD had seen their family physicians more than 5 times before coming to the clinic. 15% had seen a dermatologist more than 5 times. Family doctors. Many family doctors don't ask people with contact dermatitis about workplace exposures. CREOD patient surveys have found that only 5 to 45% of family physicians and 36 to 54% of dermatologists asked patients about workplace exposures. However, a physician survey found that almost all dermatologists and 50% of all family practitioners report taking routine workplace exposure history. Both groups reported that the main barriers to detailed history taking were lack of time and expertise. Remember Kevin, our real-life hospital worker? His family doctor consistently failed to take a detailed history, which might have led Kevin to a diagnosis sooner. Information and advice. Patients get little information and advice from physicians regarding their problem. A CREOD survey of workers with WRCD showed that doctors provided minimal advice about how to modify work to protect skin and hands. Another found that only 43% of patients reported that visits with family physicians or dermatologists helped them to understand their problem. There was a relationship between workers' satisfaction with care and how long their symptoms lasted. Family doctors. Information and advice. Patients get tools, processes, and training. Streamlined tools and processes and more training would make recognition, referral, and treatment of WRCD easier for physicians. The CREOD Physician Survey showed that improved remuneration, easily available standard tests and referral sources, templates for asking questions during history taking, and 1-800 numbers or websites for information would improve recognition and treatment of WRCD. Physicians also asked for education on how to detect WRCD early, initiate a claim, and refer to specialists. Family physicians and dermatologists reported that a lack of timely access to a specialist was an important barrier to referral. Diagnostic tests. Standard practice models and screening tests may not be enough. To make a diagnosis of allergic contact dermatitis, patch testing with chemicals associated with the work process is needed. However, most dermatologists and allergists who do patch testing only use a screening series of chemicals which may not have the chemicals that are of concern. Recovery time. It takes a long time to recover from WRCD, and disease outcomes are very poor. The CREOD study found that only 40% of people with WRCD showed clinical improvement 6 months after assessment in a clinic. Effects of WRCD. Recall Sheldon and Lee's symptoms. In addition to the rash they reported, WRCD is associated with a broad range of negative effects on health and quality of life. Click the buttons at the left to find out what the research reveals about how CD affects quality of life. Itching and pain. In a survey of people with CD, almost 75% of participants experienced itching or pain. Embarrassment. About 40% reported that CD was embarrassing, interfered with work, and with sleep. Embarrassment is associated with having the rash on visible parts of the body, such as the hands and face. Social and leisure. About 30% said that the WRCD interfered with housework and social or leisure activities. Bothersome treatment. 20% said that treatment was bothersome. Impaired hand function. A study of hand and upper extremity function in patients with CD found that 80% had impaired grip strength and 50% had numbness. 50% were unable to tuck their fingers. See image below. Effects on work. In addition to the worker health and quality of life consequences we've discussed, WRCD can have a significant impact on work which affects both the worker and their employer. Many people with WRCD lose time at work. After at least 2 years post-diagnosis, 78% were still working, but 57% had changed jobs, 66% because of their skin. Almost 70% had lost time from work, 35% for more than a month. In another study, 33% reported missing work in the past year. Even where the worker remained at work, 31% were found to be less productive. Knowledge Check 4. Check your knowledge by answering the following question. One of the most reported return-to-work barriers for WRCD patients is fear of exposure. True or false? Correct. One of the most reported RTW barriers for WRCD patients is fear of exposure. Research suggests that in addition to itching and pain, there are a number of other RTW barriers that affect workers with WRCD. Click on the buttons below to learn more. Ability to do the job safely. Example, if the person can't use the required tools. Appearance. Examples include embarrassment and issues of self-esteem and body image. PPE issues. Examples, worry that personal protective equipment may get caught in machinery. Workplace attitudes. Example, management and/or co-workers are unwilling to cooperate with RTW accommodations. Some workers, or their co-workers and supervisors, think that the rash is contagious. Workplace modifications. Example, a perceived inability to accommodate. Knowledge Check 5. Check your knowledge by answering the following question. Employers are affected by WRCD because 1. WRCD affected workers are less productive than non-affected workers. 2. WRCD often leads to absenteeism. 3. WRCD is contagious and may spread amongst employees. 4. 1 and 2. 5. 2 and 3. Correct. WRCD affected workers are less productive than non-affected workers, and WRCD often leads to absenteeism. Getting back to work. For the workplace. To facilitate a return to work, the workplace should make protective equipment available and modify work as appropriate. For the worker, actively follow up with treatment using appropriate medicine and skincare. Lack of WRCD awareness in Ontario's service sector. CREOD surveyed staff and advisory council members from the Ontario Service Safety Alliance, now known as Workplace Safety and Prevention Services, and found that they didn't know very much about WRCD. Both groups also rated knowledge among people in their sectors as low. Participants told CREOD that WRCD prevention programs are a low priority in their sector. What can you do? Click below to find out what you can do to prevent and manage WRCD outcomes in your workplace. Employers. As an employer, you should be aware of skin hazards in your workplace. You should provide appropriate training about skin exposures and how to prevent them. Wherever possible, substitute products to decrease exposure. You should also identify and provide appropriate PPE and provide appropriate wash-up facilities and moisturizer. Supervisors. Supervisors should receive training about skin exposures and how to prevent them. You should also provide appropriate training about skin exposures and how to prevent them. As a supervisor, you should also ensure appropriate prevention is in place and is being used. If you notice that a worker is having problems, investigate and encourage the worker to seek care. Workers. If you notice skin symptoms, make sure that you are using the PPE and skincare provided. Let your supervisor know if you're experiencing symptoms or are having issues with your PPE. If you develop skin disease, seek care immediately and make sure to tell your doctor about your work. Learning Summary. After participating in this e-learning session, you will have learned that work-related contact dermatitis, or WRCD, is common. WRCD is preventable. Many workers in Ontario are at risk of WRCD but don't know it. Recovery from WRCD can be difficult for a variety of reasons. And early medical intervention is critical. The earlier a person with WRCD is diagnosed and treated, the more likely they are to get better. Skin at Work Resources. References. A list of course references can be downloaded from the Resources tab above. Test your knowledge. Congratulations on completing the content portion of this module. It's now time to test your knowledge of work-related contact dermatitis. On the following slides, you'll be presented with a total of 10 questions. To achieve a passing grade, you must obtain 80%. Good luck! Click Next to begin. Work-related contact dermatitis quiz. 1. The two types of contact dermatitis are A. Itchy and painful. B. Itchy and allergen. 2. Workers whose skin is exposed to liquids for long periods of time are prone to A. Irritant contact dermatitis. B. Allergen contact dermatitis. Three. The percentage of male indoor cleaners reporting a rash in the past year is A. 9%, B. 17%, C. 21%, D. 46%. Four. Electronics workers, cooks and caterers, and healthcare workers are amongst the most common occupations affected by WRCD. True? False? 5. At least 5 of the most common occupational allergens are used in paints and primers. True? False? 6. Following exposure to an irritant or allergen, a WRCD rash can appear immediately, within days, within months, any of the above. 7. Which of the following is a true statement? WRCD has been associated with hand grip impairment and numbness. Most family doctors can provide advice on skin and hand protection. Occupational asthma has been associated with WRCD. Both A and C. All of the above. 8. Which of the following is not an appropriate method to prevent WRCD? Powder-free latex gloves, cotton glove liners, barrier creams, lipid-rich moisturizers. Nine. Standard patch testing is sufficient to diagnose WRCD. True. The standard screening series covers all workplace irritants and allergens. Sometimes true and sometimes false. Patch testing is needed to diagnose WRCD, but the standard screening series may or may not contain the chemicals that are of concern. False. The standard screening series is not designed to test for workplace allergens. 10. Which of the following is not a suggested method for employers to use when helping an employee return to work after a WRCD diagnosis? Let colleagues know about the employee's condition. Make protective equipment available. Modify work as required. Provide training about skin exposures and how to prevent them.